avisan? Okay. So we are ready to start.
¿Estamos listos para comenzar?
Okay. So good morning, everyone.
Buenos días a todos y muchas gracias por estar presentes y muchas gracias a nuestros invitados, a los reporteros que están presentes aquí en la sede de la OPS y los que están conectados a través del website, a nuestros amigos de los medios sociales y los que nos siguen a través del Facebook. Estamos difundiendo en inglés y en español, así que por favor siéntanse en la libertad de hacer las preguntas en cualquiera de los dos idiomas.
Live in either language. For those connected virtually, please use the chat on live stream. Use the chat also in Facebook Live. Or our email address, mediateam@pajo.org. We are here today at the Pan American Health Organization, Regional Office of the World Health Organization, to hear about a truly historic achievement for the Americas regarding the elimination of measles, as you just heard minutes ago. To make that announcement, we have with us our director and several special guests who have been key partners in achieving this goal. We have Carissa Etienne, director of the Pan American Health Organization, Marceline Dahl-Regis, chair of the International Expert Committee for the Documentation and Verification of Measles, Rubiola, and Congenital Rubiola Syndrome Elimination in the Americas, Susan Reef, team lead of the Rubiola team at the Global Immunization Division in the Centers for Disease Control and Prevention, the U.S., Mary Aggox, senior advisor of Measles and Rubiola Initiative and International Service from the American Red Cross. With no further ado, I would like to invite our first speaker, Dr. Carissa Etienne, director of the Pan American Health Organization. Dr. Etienne.
Thank you, and I wish to greet listeners on really this historic day for the region of the Americas. In 1971, that is nearly half a century ago, the region of the Americas established itself as a global leader in eliminating vaccine-preventable diseases. In that year, we were certified as the first region in the world to end endemic transmission of smallpox. 23 years later, in 1994, this region was also the first region to eliminate polio. And just over a year ago, our region was declared the first to eliminate endemic transmission of rubella and congenital rubella syndrome. Today, I am thrilled to announce that the region of the Americas has become the first region in the world to eliminate the endemic transmission of measles, one of the most infectious diseases known to humankind and the leading killer among vaccine-preventable diseases. As recently as 25 years ago, measles killed over 500,000 children worldwide each year. This is truly a historic day. It is proof of the remarkable success that can be achieved when countries work steadfastly together towards common goals. It is the result of a commitment made more than 2 decades ago, in 1994, when the countries of the Americas committed themselves to ending measles by the turn of the 21st century. This historic milestone would never have been possible without the strong political commitment of our member governments in ensuring that all children have access to life-saving vaccines. It would not have been possible without the commitment of health workers and volunteers who worked tirelessly to take the benefits of vaccines to all people, including those in vulnerable and hard-to-reach communities. And I believe that it would not have been possible without the strong leadership and coordination provided by the Pan American Health Organization, the Regional Office for the Americas of the World Health Organization. It would not be possible without the revolving fund for vaccine, which has made vaccines affordable for all of our countries. On this momentous day, after 22 years of intense effort, I wish to recognize our partners who have worked with us and provided financial support to reach this goal. These include the U.S. Centers for Disease Control, the Public Health Agency of Canada, American Red Cross, the UN Foundation, UNICEF, Sabin Institute, the Match of Dimes, among many, many others. This would not be possible without the tireless efforts of our heroes like Dr. D.A. Henderson and Dr. Ciro de Quadros, of our own Dr. John Andrews, of Dr. Gina Tambini, and Dr. Carlos. But many of those people who worked tirelessly in the leadership of the immunization program. And it would not be possible without the leadership of our former directors, Dr. George Allen and Dr. Muta Roses. I want to commend our member states for holding themselves accountable and for dedicating the necessary resources to rid of this disease. Let me also thank the members of the International Experts Committee for their support during the last 6 years, for their tenacity, their dedication, and their commitment. Their work has been an important piece of the history that our region is making today. I also want to stress that our work is not yet done. We must not become complacent with this achievement, but rather we need to protect it zealously. Measles still circulates widely in other parts of the world, and so we must be prepared to respond to imported cases. It is critical that we continue to maintain high vaccination coverage rates, and it is crucial that any suspected measles case must be reported to the authorities immediately. Today, however, we can all celebrate what is truly an extraordinary milestone, and we want to congratulate everyone who played a role in getting the job done. Bye-bye endemic transmission of measles in the Americas. Thank you.
Thank you, Dr. Etienne. Now I would like to introduce Marceline Dahl-Regis, Chair of the International Expert Committee for the Documentation and Verification of Measles, Rubiola, and Congenital Rubiola Syndrome Elimination in the Americas. Dr. Dahl-Regis, thank you.
Thank you. Good morning. Today, I have the pleasure of announcing on behalf of the International Expert Committee that the Americas region has interrupted endemic measles transmission. By 2002, the last endemic measles case was reported in the Americas, and in 2007, the Americas embarked upon the process of documenting measles, rubella, and congenital rubella syndrome. To this end, documenting the elimination. To this end, the countries of the region established their national verification commissions, excuse me, whose role was to document and confirm measles elimination in the respective countries. And PAHO, at that time, also convened the International Expert Committee that has remained together for the past 6 years. The role of the national programs of expanded immunization and the stellar work of the national commissions appointed by their governments are best practices we wish to share with other regions of the world, with the hope that they too can eliminate endemic transmission of measles. The IEC was pleased to receive the independent reports signed by the respective National Verification Commission chairs between 2011 and 2014, and for the second time in 2016. The task of verification was not without its challenges, and countries overcame a number of geopolitical difficulties, including obtaining high vaccination coverage for very mobile populations, for migrants, for cross-border, those that came across the border, limited and sometimes no access to deprived areas, and the presence of areas still with conflict situations. Very large countries were able to manage the challenge of communication between federal and state governments, and municipalities. On behalf of each member of the International Expert Committee, I wish to express heartfelt thanks to the many governments and institutions that have allowed the effort to continue. As you've heard, the journey is not finished yet, and the regional and national efforts must continue. We must now maintain the elimination of transmission in the Americas and appeal for global eradication of measles. Thank you very much.
Thank you, Dr. Dal-Regis. The role of the partners has been very, very important also in this achievement. So in that regards, now I would like to introduce Susan Reeve, team lead of the Rubiola team at the Global Immunization Division of Center of Global Health at the United States Centers for Disease Control and Prevention, CDC.
Thank you, and good morning. The CDC would like to congratulate PAHO and the countries in the region of the Americas for this historic achievement of an elimination of endemic measles in the region of the Americas. This achievement was accomplished through dedication, commitment, hard work, and ownership of the goal in the countries. Partnerships at all levels have played a significant role in the achievement of elimination of endemic measles in this region. CDC, as one of the founding partners of the Measles and Rubella Initiative, played a key role in arriving to where we are today. By joining forces with the Pan American Health Organization and other partners, throughout the process, CDC has provided financial and technical support, including epidemiological surveillance and laboratory support. Thank you, and congratulations to PAHO and the countries.
Thank you, Dr. Reeve. Just before introducing the next speaker, I just wanted to say that Dr. Etienne had to go because of the Directing Council, and Francisco Becerra, Assistant Director of PAHO, just joined us in the table. As I was saying, partners were very important in this achievement. Now I would like to introduce a key partner, Mary Agog, Senior Advisor from Measles and Rubiola Initiative, an international service from the American Red Cross.
Thank you very much. Dear esteemed colleagues, on behalf of the Measles and Rubella Initiative, I extend my deepest congratulations to the Ministries of Health of the countries of the region, to the International Expert Committee, to PAHO, and to all the partners who have worked so tirelessly and successfully to achieve the elimination of both measles and rubella in the Americas. The Measles and Rubella Initiative is a partnership of the American Red Cross, U.S. Centers for Disease Control and Prevention, UNICEF, United Nations Foundation, and the World Health Organization. The initiative was formed in 2001 at a time when measles was one of the top 5 killers of children under the age of 5. Measles was a top killer despite the fact that effective, inexpensive, and safe vaccines had been in existence for decades. The vision of the Measles and Rubella Initiative is to achieve and maintain a world without measles, rubella, and congenital rubella syndrome. Today, with this tremendous accomplishment of the elimination of measles and rubella in the Americas, we have taken a great leap forwards toward this vision. Today, we can also celebrate the global accomplishments since the initiative was formed. Over 2 billion children have been vaccinated, resulting in a 79% decrease in the number of global measles cases. Overall, 17.1 million lives have been saved due to measles vaccination. Rubella-containing vaccine has been introduced into the routine immunization schedule in 149, or 77%, of countries globally. However, tomorrow, we will continue to tackle our challenges. 315 children die each day from measles. Over 100,000 children are born with congenital rubella syndrome every year, all needlessly. As the experts in the Americas have warned us, we must remember that the world is interconnected. Measles and rubella everywhere is a threat, anywhere is a threat to people everywhere. Importations from other parts of the world into the Americas will continue, and we must be ready to detect and respond quickly and to maintain strong routine immunization systems to protect the populations. However, today, let us celebrate. The elimination of measles and rubella in the Americas benefits children and families and motivates many others around the world to continue working towards a vision of a world without measles and rubella. Congratulations.
Thank you. Thank you all for your statements. Now we will take questions first from the floor. Primero puede ser en español, puede ser en inglés. Hay traducción simultánea. También vamos a tomar preguntas.
We will also be taking questions from the live stream and Facebook Live in case there should be any.
You can ask your question in Spanish or English. That you can also send us your questions through email, mediateam@pajo.org. So, Silvia Ayuso, del País de Madrid.
Thank you very much. I have a question for any of you. I mean, despite all the studies and the evidences, there are still many groups in the US, for example, but also in Europe that are reluctant. I mean, there's some anti-vaccine movement. What would you say to them in a day like this? What would be your message to try to convince them that there is that of the necessity of vaccines like measles?
Dr. Becerra, Susan.
Dr. Becerra, Susan.
Okay, thank you. I think this is an interesting question and a call for action to realize the relevance of vaccines. We have shown today that this kind of achievements brings a lot of good things for children and a lot of good things for the families of these children. I think that there was an anti-vaccine promoter that realized late that one of her children had measles, and she came to realize the value of vaccines. So I hope that many other parents who think that vaccines are not needed consider the value of vaccines. When we talk about thousands of lives being saved through vaccination, it's a reality. We are not making it up. This is a true statement that we have been working together, all countries in the world, to promote vaccination because vaccines do save children's lives. So I think that this is a clear message of the value of vaccines and what we can achieve, and this is a very good example of how all the countries in the region joined forces to achieve this historical moment.
Dr. Dalbridges, you wanted to add something.
Yes, thank you. When you do not immunize your child, you put other children at risk. Because when your child gets measles, it is highly infectious. So you're not only making the decision for your own child, you're also making a decision that can influence and hurt others. I think it's important that the vaccine refusers, those who refuse vaccines, need to be aware of this and to be aware that it is, yes, most recover without sequelae from measles, but some do not. As a young physician, I can tell you, without measles vaccine, the hospital wards had a lot of children with large heads, hydrocephaly, and cognitive impairment. So it is a risk that you are taking, and it's not a risk that you're taking for yourself, it's a risk you're taking for others as well.
Okay, thank you. Anything else from the floor? Any other question? We have tons through live stream, so you're not dismissed yet. Okay, so to the following question that we receive in Spanish. Sebastián
Urbina from El Mercurio newspaper in Chile is asking the following. How is it possible that the Americas be declared as free from measles when we see that there was an important outbreak of this disease in California back in 2015? I believe that we can invite Dr. Cuauhtémoc Ruiz, head of the Immunization Division of PAHO, who joined the conference precisely to answer these questions. Thank you, Leti, and thank you, Sebastián, for your question. What is being stated today is indeed the fact that the Americas are free of endemic transmission of measles virus, which circulates in the region. The cases that you mentioned that occurred in the United States, in this case in Disneyland amusement park, were related to viruses imported from other regions in the world. This is important because other regions in the world must take the necessary steps in order to try to prevent the occurrence of these diseases. Whilst that does not happen, the risk of a reintroduction of cases and cases associated to those introductions will continue to be latent. Vis-à-vis the situation, we must raise vaccination coverage in our region and better epidemiological surveillance to be able to respond timely. Though the cases that you referred that happened in the United States were imported cases and not cases associated to an endemic transmission of the disease in our region. Thank you, Dr. Ruiz.
Okay. Yes, Dr. Dalreti, sorry.
The committee had a number of criteria to establish that there was no endemic transmission of measles. Outbreak situations are different. And the countries had to have no cases for 1 year after they've established transmission has been interrupted. We do know that there will always be a vulnerable person or group, and that's why we aim to have high immunization coverage, as Dr. Cuauhtémoc said. And it's important to maintain it because the rest of the world travels and brings in measles, so we have to have our high coverage in order to maintain the status that we have.
Thank you. I have another question from Sebastián Urbina. Pregunta si esta declaración...
Whether this declaration means that there will be no more vaccinating in the Americas, or that we have to continue to vaccinate until it has been eradicated entirely from the whole world. Thank you, Leti. Yes, in fact, we have to continue to give vaccines to continue having protection. We have to continue to protect ourselves from those regions that have not attained vaccination coverage or elimination, because there are people who may come and visit us with the disease, and if we have a number which is sufficiently susceptible, we could take the virus. So we must maintain high vaccination rates so as to avoid any possible contagion. Another question, which measures do you advise countries to take where the parents refuse to give the vaccine to their children? Cuauhtémoc, Dr. Ruiz. Thank you. As Dr. Marcelin was saying earlier, when alluding to anti-vaccine groups, first thing is to submit the evidence as to the benefits of vaccination, not just as regards the health of the child who's getting the vaccine, but the protection this affords to the rest of the community. The second point has to do with providing all the available scientific information, particularly as regards safety of the vaccines, which is one of the questions in the minds of parents oftentimes, and also to give every possible facilities so that people may have access to safe and quality vaccines. Thank you, Dr. Becerra. Here too we must recall that the viruses have no borders. and they don't differentiate among social classes. Not because the children live in a certain high social class will they be exempt of a possible infection. If they are not vaccinated, they're susceptible. The viruses go from person to person, and a person who may have been vaccinated could transmit the virus to someone else. That person may not get the disease, but may be part of a transmission chain. So we must be aware that a child without vaccinating, notwithstanding his social status, is liable of becoming infected. Mary Others, de la Cruz Roja Americana.
A comment from the perspective of the global measles and rubella initiative. So while we are here very much celebrating the tremendous success in the Americas, we nonetheless continue our work in the rest of the world. Because as we've heard, measles is one of the most infectious diseases that humans know. And it's just a plane ride away from coming into any country in the Americas. So the work of the Measles and Rubella Initiative, I assure you, will continue. And I hope someday that we'll be able to join other regions as well in celebrating a similar accomplishment. And we look forward to that world where we no longer have to worry about measles and rubella and the diseases are truly eliminated. Thank you.
Thank you. Sorry. Regarding that, actually, I have a couple of questions from Voice of America. Is there a plan if the virus is reintroduced, for example, like the Disney outbreak, or in Venezuela, or poor areas, or other countries in the Americas? And also, how vulnerable will the Americas be to the reintroduction of the virus? Kind of the same aligned question. Dr. Ruiz?
Muchas gracias. Justo.
Thank you very much. Precisely in the Directing Council of PAHO that we are holding today, we have been discussing the action plan to maintain the elimination of measles and rubella in the Americas, the action plan to maintain the Americas free of measles and rubella. In that plan, one of the most important points established in it is to increase epidemiological surveillance for the timely detection of suspicious cases, to react opportunely in case of suspected cases by means of vaccination around the movement of those individuals, and to seek out all those potential places where the people may have been visiting, to increase coverage and maintain homogeneous coverage throughout the entire population, and not just in areas where we have a high degree of coverage and in others a low degree. To give the vaccine to those demographic groups which are at a greater risk, such as airport workers, port workers, where tourism services, those who drive taxi cabs, and so on, because as our colleagues have very well stated, the risk of a reintroduction precisely comes from other regions. So the first persons who enter in contact with those persons are those who render tourism services or those who provide transportation services. So there's a whole plan for this purpose. Something that has been said as part of the commitment by countries is to maintain an adequate and timely response vis-à-vis the appearance of any case or outbreak, and that as of now has allowed for the Americas to be free of measles. Thank you. Thank you, Dr. Ruiz.
You wanted to jump in?
It's a simple answer. Take the example of the country I come from. You have 400,000 people, and you have 6 million people who come and visit the country, and we don't have measles because of high immunization coverage. That's the simple answer. Poor, male, female, social class, everyone needs to be immunized. And with high coverage, that is how you prevent reintroduction of measles.
Thank you. There was a follow-up question from El País de Madrid.
Yes, en español si puede ser. Le habían comentado una...
There was a question in some countries in the region which are going through difficult situations, such as Venezuela, where there has been a claim that there is a lack of certain medication. I don't know if this is being dealt with, or is there a plan in case there should be a lack in one of the countries of the Americas with regard to vaccination? Do you have an already established plan? Is there a concern within the region vis-a-vis the situation, for it affects not just one country, but it is a matter of a joint effort? Thank you very much. Fortunately, the immunization program runs through all the countries of Latin America and the Caribbean, and it is considered to be a public good. Since it is a public good, it has become a high priority for states. As of today, we can tell you with certainty that none of the countries in our region, notwithstanding conditions it might be going through, the vaccination program has been reduced. Of course, the risks continue to exist, but as of yet, this has not been reduced. We as an organization have been working broadly with countries in order to ensure that vaccination coverage be maintained at a high and homogeneous level. None of the countries, by the way, at this point in time could possibly report a lack of the vaccine or a problem along those lines. All the vaccines, as the director has told us, which are purchased by Latin America and the Caribbean, are purchased through the revolving fund, and this has guaranteed that all countries may have them. If at any point in time there should be any possible reintroduction of the virus in any of the countries of the Americas, firstly, health ministries have the capacity and capability to respond. And whenever necessary, Pan American Health Organization and the other member states in the region are always ready in a solidary fashion to work together with those countries.
Questions. Can you please define endemic transmission of measles versus the kind of outbreaks we have seen in the U.S.? That's a question from NPR. Also, how long does it have to... ¿Cuánto tiempo tiene que pasar sin transmisión?
How much time has to elapse without endemic transmission for a region to be declared as free of this ailment? For a region to be declared free of the disease, at least a year has to go by without any case of endemic transmission. 3 years, rather, correction. And follow-up has to take place year after year. Within that time lapse, we must make certain there are no cases. When there's an endemic transmission, it's a local virus that is growing in the country, as opposed to an actual outbreak when this is detected among a small population group with a case coming from abroad, which affect people who have entered in contact with that individual. Thanks to the progress of science, we can define where the virus is coming from. We immediately conduct the analysis and know whether it's coming from Asia, from Europe, or from the endemic types of the Americas. We can distinguish the case in California, which we knew it was coming from Asia, and we were able to stop it because of steps taken. We conduct follow-up, and then we see how the transmission of the disease is taking place, and we can rapidly establish control measures. Thank you, Dr. Becerra.
Minimum vaccination coverage needed to prevent imported outbreaks from turning into endemic transmission. Dr. Ruiz.
Bueno, la cobertura ideal.
Ideal coverage would always be, of course, 100%. As has been said by our colleagues, the measles virus is highly communicable, but according to the studies we have, when we have vaccination coverages on the national and municipal and local levels above 95%, the likelihood of transmission is reduced in a very substantial way. So that's a recommendation we have for the region of the Americas, to maintain coverage above 95%. However, in the region of the Americas, we also have another strategy regarding this situation, which is called the second vaccination opportunity. So children get the vaccine at 1 year of age, and at 18 months they get the booster, a second dose of the vaccine. And this second dose is in order for us to find those children who may have had a problem of vaccine failure, which could have happened, or those children who, because of any reason, perhaps did not get the vaccine initially. So in the Americas, we established this so-called second opportunity vaccination round. So all programs of vaccination in the Americas are applying 2 doses of this vaccine against measles and rubella.
And on that, the first case in the Disneyland outbreak was imported. The rest were locally transmitted. Isn't it premature to declare the hemisphere free of endemic transmission when vaccination rates are so low that a single imported case can become more than 100 locally transmitted ones? Okay, Dr. Susan Reeve from CDC.
To say that a country has endemic transmission, they need 12 months of continuous circulation. As you know, that what happened is that sometimes people that are unvaccinated are in groups, and so you can see a cluster of cases, and so they also are they also, I guess, work together and they commune together, and so you see the expansion of the cases. However, the outbreak was stopped very quickly. It took a few months, but it was stopped, so that was not endemic transmission. I think what's very important is that most of the cases were in the unvaccinated population, and compared to the people that are vaccinated, it was just a very, very tiny group. And I think what happens with the countries that have eliminated disease, measles and rubella, that 1 or 2 cases or 100 cases is a big issue. When you look over into the global area, it's tens of thousands of cases. So I guess for the outbreak for California was in a certain specific unvaccinated population, and we were able to stop it very quickly.
Thank you. Okay. Another question, and I think we are going to wrap up with this one because we have to leave. This one is from AFP, de Aldo Gamboa. Dice, después de la...
And it reads, after the elimination of measles, what is the next objective, the next goal of PAHO? What are the disease within the list of diseases preventable by vaccination that we may be able to certify? First of all, our first objective is to maintain the region free of polio, rubella, and measles. And this does not mean that with today's declaration our work has concluded, as Dr. Marceline told us, but rather to maintain and double our efforts in order to be a region free of polio, measles, and rubella. The following step, which we're not starting only today, we have started it years ago, is declaring the region free of neonatal tetanus. The only challenge we have for us is Haiti, where we're hoping to reach our goal throughout this year so that the region may be declared free of neonatal tetanus. And we have made progress in the elimination of hepatitis B. Hepatitis B, which, as you know, is a preventable disease by vaccination, where we have implemented the vaccine to the newborn with hepatitis B as part of the vaccination program. And this will allow us to forge ahead toward the elimination of the transmission of hepatitis B.
It seems that we have another question, and with this one, I promise you, I'll let you go. Okay. Follow. It is normal. If it normally takes 3 years of surveillance to declare a region measles free, why did it take from 2002 to 2016 to do it this time? No. Dr. Dal Regis from the committee.
Thank you. It's really hard. It's not an easy task. And we found that in even the large countries, the experience was that the communication between the municipalities, the federal states, and the federal and state government, if you have coverage, the information has to flow throughout the municipalities, the state and federal government. That was an issue in a large country. In another country, the difficulty was that you had so many migrants and very mobile groups that could not, they didn't have cards, you couldn't access them. There were real challenges when you have some of our territories in the Americas. You want to say there are no borders. The borders are ill-defined, and there's movement back and forth, and that was a particular challenge. Then there are issues related to situations that countries are still in conflict situations, and we cannot get through to some areas because of the domestic fighting that goes on. And without coverage, without immunizing the children, you're not going to get high coverage. You're going to have vulnerable groups. Measles is very infectious. And there's a lot of movement between urban and rural areas. And in the urban areas, you have a lot of travel, importation of measles. So there were many, many challenges, but we are pleased that the countries that had these situations invested very heavily. I think of Ecuador, I think of Colombia, I think of Venezuela, that really financially supported all that was necessary to interrupt the transmission in their countries. They really deserve a significant mention, and so did Brazil. Brazil was really challenged, and they came through. They did an excellent job. And we learned from each of the experiences that we have had with the countries.
Thank you, Dr. Ruiz. And yes.
Solamente para poner...
just in order to bring some magnitude, or to give you an overall picture of what has just been stated, in order to eliminate measles and rubella, the countries had to work intensely to improve their vaccination coverage. But the strategy was done not just through the regular program, but they implemented very important vaccination campaigns. We deemed that over 140 million children under 5 years of age were vaccinated as a result of the campaigns that we have, and some 250 million of young teenagers and adolescents were vaccinated to prevent rubella and cases of measles. All of this tells you about the size of the efforts undertaken by states to maintain the region free of these diseases, and this effort will have to be pursued until we manage to have a total global elimination. Thank you, Dr.
We would like to thank you very much for being here. I think Dr. Reeve had something that she wanted to share with Dr.
Yeah. As a CDC representative, we'd like to present you with this poster. There's another one in English that says, "Measles and rubella don't live here anymore, doesn't live here anymore." This is in recognition of the great achievement for both measles and rubella elimination for PAHO and for the countries of the Americas. Here is this.
Thank you very much.
So,
Here?
thank you, everybody, and well, you arranged to take the picture. We're going to thank everybody. We're going to invite you to send us your questions if they didn't get through. We're going to make sure to send you the answers, and have a great day. Until next time.
Thank you.
Bye.